You are at Mrs. Robinson's home for a healthcare visit. She is 85 years old. Because she spent 3 weeks in a hospital for a bronchial superinfection, having returned home 2 days previous, you are tasked with taking her temperature orally. A person's temperature indicates the body's internal heat. A temperature above 38 degrees centigrade is considered feverish. Fever is generally a sign of infection, although other factors can also come into play. Fever manifests itself differently in elderly people because their base temperature is lower than in adults or children. Elderly people could have an infection even though their temperature shows only a slight elevation. One must be vigilant in such cases.
Good morning, Mrs. Robinson. So we're going to take your temperature this morning, okay?
Oh, okay, that's good. You know what? I was sweating a bit last night, and I was wondering, could it be that I still have a fever after having been treated for the infection?
Maybe. If so, we'll let the nurse know. We'll notify her, okay?
Oh, okay.
So we'll start by taking temperature, and then we'll see from there, okay?
Yeah, okay.
All right. So
The usual means of taking a person's temperature are as follows: oral, mouth; axillary, armpit; rectal, anal; or tympanic, ear. Note that the baseline values differ for each method, some requiring special thermometers, tympanic for example. Standard thermometers should never be used for tympanic temperature taking, as this could lead to eardrum damage and loss of hearing. Also, any thermometer that was previously used for rectal temperature taking should never be used orally or axillary for obvious hygiene reasons due to the risk of contamination.
we'll be taking your temperature orally this morning,
Okay.
okay?
Yeah.
Have you eaten, drank, chewed gum, okay, or smoked in the last 30 minutes?
No, none of those. None of those, no.
Okay.
Because using the oral method is easily accessible, precise, fast, and comfortable, it is the preferred means in adults. However, the readings could be falsified if the person has eaten, drunk, smoked, or chewed gum within the last 30 minutes, or if the person is receiving oxygen. There are some contraindications as well if the person has had oral surgery or infection recently. Stress, hormonal changes, age and surroundings, and physical exercise can all influence body temperature. The PSW puts a sheath on the thermometer if it is shared by other users. The disposable sheaths protect them from the propagation of microorganisms.
Perfect. So I'm going to ask you to open your mouth. It's going
Okay.
to go under your tongue.
Okay, yeah.
You're going to just press your lips on the thermometer, but just don't bite on it, okay?
Okay, yeah.
The PSW puts the thermometer under the tongue and near the frenulum and asks the person to close her mouth. When the signal sounds, the thermometer can be taken out and the PSW can record the reading. Then the sheath is discarded. Some thermometers have a button to push and or disinfected wearing non-sterile gloves if necessary.
So your temperature is 38.2. It's a little high.
Oh, okay.
So what I'll do is I'll notify the nurse, okay? And she's going to give you a call with the rest that we need to do.
Oh, fine. Thank you.
Okay? How are you feeling right now?
I'm not too bad. I'm okay. I'm fine.
Okay.
Record the temperature on the form. If the PSW notes a reading below or above normal values, the nursing staff should be notified as soon as possible.
Perfect. So she'll give you a call, okay?
Okay, thank you.